No, that's not it. Copy link address.
Hi.
Good evening. How are you doing today?
Good. I'm going to check my lighting. It's been so bad in this room. I look like a weird ghost. I'm
You look fine.
going to try to figure it out while we're here.
Yeah. Perfect.
Let's see. It's, I think, better. There we go. It was a little bit better, but not the best. And very ghostly.
How do you pronounce your last name?
Narasimhan.
Narasimhan.
Mm-hmm.
Perfect.
I
I had some technical difficulties getting on my at first. But it's good to start early.
Yeah, I'm gonna try to switch out the lamp situation here and see if we can.
Okay.
Thank you.
Oh, sure.
No, it's better. All right. Just checking. In terms of like questions, or it's like a fluid conversation, right? I don't think you said
Um,
slide
I
prep.
think no, yeah, there are no slides. It's just conversation. Give me 1 second. I think. Let's see. Yeah, so I have some preset questions that exist. Did you get those?
Yes, I believe you did send them.
Okay.
Let me double
Okay.
check and get them and pull them up.
Okay. Perfect.
Chris, can you hear me now?
Yeah, I hear you. Good
Okay.
evening,
Good
Representative
evening.
Schofield. How are you
Good
doing?
evening. Great. How's everyone doing?
Doing good. We have Dr. Nara Simmons from Emory, Rollins School of Public Health on with us.
Hi.
Good evening. Hi, how are you?
Good. So nice to meet you.
Nice to meet you as well.
I'm excited. I already tweeted out about this, so hopefully my 5 Twitter followers will come and join. my big crowd.
Your big crowd.
You-
Well, this is
you mean-
we're recording it, and it is going to be on all social media after today.
That'll be
So
good.
if anyone misses it, then they can watch it there.
That's great. I'm kidding. I have more than 5 Twitter followers, but it's not
I'm
as
sure.
well, you have 4 more than I do.
No, you have. I linked to yours. I know how many Twitter followers.
Let's see if I can put the light on. Yeah, I can write with the light on. That's better.
Perfect. I think we're still waiting on a few. See, we have 2 more guests. And then we have my co-host as well. She's signing on soon. So. Are you dressed for, no, it's not breast cancer awareness anymore. You're just dressed in pink today, Representative Schofield? Okay.
There we go. All right, I just have to realize what I need to tap to get on. Yes, I just put on some pink today. Pretty in pink.
It looks good. It looks good.
Thank you. Yeah. Do you hear background noises at all?
No, no,
okay.
No background noises.
So
It's perfect.
Okay.
Perfect. Hi, Tamika. You'll just have to change your name. I sent you my link. All right, Tamika.
Well, welcome everyone. We'll go ahead and get started. We are here with an awesome panel tonight. We will definitely have in-depth introductions, but we are here with State Representative Kim Schofield, Raula Abi-Samra with the State Campaign Manager for Amplify Georgia, Dr. Suba Narisimhan, I'm trying, Professor of Emory University Rollins School of Public Health, and Naomi Destabel, Community Outreach Manager of Feminist Women's Health Center. So you'll learn more about our panelists as Chris will do an introduction later, but I am Tamika English. I'm the Source Manager Program Manager, the Source Leadership Program Manager with SisterLove. Source Leadership is a program within SisterLove that focuses on centering marginalized individuals and lifting them up by way of education and training so that we can see them in places of leadership and power and in positions to be on the front end of solutions for them and for their communities. We believe at SisterLove, that it's not enough to show up in communities with these grand solutions to problems. We have to include the people with the problems in the planning for those solutions so that we are really showing up fully in the way that they need us to. So that's what Source Leadership does, and that's what I manage at SisterLove. I'm very excited to be a part of this conversation. I'm here with Chris, who is our Policy and Advocacy Program Manager, and he will be taking care of our panelist introductions for the evening. Chris.
Thank you, Tamika, for the introduction. So today we have with us some amazing speakers from different walks of life. And I'm so happy and really, really enthralled by everything that each of them does. So I'll go over with you our speakers and their biographies. So we have Naomi Destabel, who is an artist and doula and social justice advocate who works in the intersections of education, outreach, and community development in East Africa, Central America, and the United States. Her work centers on maternal health and rights, reproductive justice, and refugees resettlement. Currently, she serves as the Community Outreach Manager at Feminist Women's Health Center of Atlanta. FWHC offers compassionate abortion care as a part of comprehensive reproductive health services and works to improve access for traditionally underserved communities. Next, we have Rula Rula Abi-Samra. She is the State Campaign Director for Amplify Georgia Collaborative, where reproductive justice groups and their allies organize to expand abortion access in Georgia. Rula is the eldest daughter of Lebanese immigrants who settled in New Orleans and is passionate about the resistance and resilience of Southern people of color. Supporting people seeking abortion care changed her life and led her to reproductive justice organizing. They have a bachelor's in political science and a master's in public health from Emory University. Next, we have State Representative Kim Schofield, who serves the citizens of House District 60, which includes areas of Southeast Atlanta, East Point, College Park, Forest Park, and Hateville. She was elected to the Georgia General Assembly in 2017 and serves on the Small Business Administration and the Health and Human Services Committee. She holds several health policy positions on state and federal levels. She has introduced legislation that would create a grant program to encourage certain physicians to practice in underserved areas of the state. Representative Schofield has also advocated for expanding Medicaid and has helped pass homestead exemptions for senior citizens in her district. She has also worked to improve the workplace equity, pay equity, and she advocates for environmental justice in agriculture. She is a personal development strategist. She is also a lupus researcher and specialist with a focus on social determinants of health, epidemiology, and health equity at Emory University. And then next, Dr. Subsari Narasimhan, is a public health social scientist specializing in sexual and reproductive health, maternal health, and child health, and intimate partner violence in sub-Saharan Africa, Asia, and the southeastern US. She completed her PhD in community health sciences at the University of California in Los Angeles, Fielding School of Public Health, where she was a Bixby Doctor Fellow, Child and Family Health Trainee, and Eunice Kennedy Shriver NICHD predoctoral training. Currently, she is co-principal investigator on several studies focusing on reproductive health, birth care and support, and abortion, including the Abortion Bans Project, which studies state-level legislative debate on 6-week abortion bans, for which she received the 2019 Society of Family Planning Emerging Scholar Award, Pravada, which examines provisions of medical abortion implementation via telehealth and a pilot study focused on impact of COVID-19 on experience of prenatal care, birth support, and delivery for first-time parents. So I'd like to thank all of our speakers for being here with us today and welcome you to our presentation.
Thank you, Chris.
Thanks for having us. Yeah, thank you.
Happy to be here. Awesome. Thank you so much, Chris, for those introductions. And thank you again for our panelists for being here. We'll jump right into this conversation. I'm going to start with a few questions and I will just kind of call on the whole panel or you individually to answer. The first question will be for the total panel. And I see here that Representative Schofield, I see you in transit. So I'm going to ask you first so you can go ahead and get yours out of the way. How does that sound?
That sounds fine.
Okay.
I'm here. I'm good to see you guys.
Very, very good. So my first question for the entire panel, starting with Representative Schofield, what is, from your perspective, reproductive justice? And how does the subject matter intersect with, the gender boundaries, cisgender folks, transgender males, and females of color? Talk to us a little bit about that.
So thank you. And again, thank you to SisterLove for having me here and a part of this conversation. Thank you to the esteemed panel and to my colleague and friend, Chris Reed. Listen, when we talk about reproductive justice, we talk about the part of our personal space, our bodily autonomy to make the decisions that we need to make. That's not done by the legislature. That's not done by the government. Reproductive justice is just that, the ability to procreate or not, but to protect our space of our bodily functions as people and women in particular. And we're fighting to protect those rights. When I think about the challenges that we have today in protecting reproductive justice, it's a human right. It is not a right that is made by, again, a system, but it's made in privacy and in tandem with a personal decision, physicians and other people that we deem should be in the room.
Thank you so much, Representative. Very, very good. And I will ask that same question of Naomi. Naomi, talk to us a little bit about what reproductive justice is from your lens and how what the implications are for cisgender folks and folks of transgender experience as well.
Sure. So at the Feminist Women's Health Center, our approach and perspective around reproductive justice is really centered from a holistic lens where the folks that we serve in our community and our patients are honored. And reproductive justice encompasses more than just healthcare, but racial justice and economic justice. And so when I think about folks that come into our clinic, a lot of the times they're coming in for one service and getting connected to other services, getting connected to mutual aid. Sometimes the needs that people have are different, right? Like I recognize for folks in different marginalized communities, folks who might be non-binary, folks who might identify as trans, the way that they're accessing reproductive health care will look different from that of folks who identify as cisgender. But the needs are important to be provided for folks from a holistic place. And really centering the full individual is really important in our work. And so when I think of reproductive justice, I like to think really big picture when we're serving folks around the different intersecting identities that they have.
Absolutely. Thank you so much. And Rolla, tell us a little bit about your perspective on reproductive justice and how it intersects with the experiences of cisgender and trans folks.
I'll set the record straight. It's Rula. It rhymes with doula.
Okay,
I'm not a doula, but I always wanted to be.
Thank you, Rula.
Yeah, thank you. And so reproductive justice, I'll say a few things, one of which is that my organization, Amplify, is a collaborative of 7 organizations that work in reproductive health, rights, and justice. Our focus, our purpose for being created by the partners was to protect and expand abortion access in Georgia at the state and local levels of advocacy. That said, we are guided by the reproductive justice framework and the leaders who helped create this collaborative with reproductive justice values in mind. And that framework is, as the values that are surfacing in the answers so far are mentioning, it's much broader than one single reproductive experience or one single decision point that you may have in a pregnancy or in your reproductive life. And so a few things that I always try to mention is that reproductive justice is a framework that was created by women of color, especially led by Black women, that it centers the fact that racial oppression, gender oppression, and class oppression are all intertwined for some of us, right? Yeah. And that you can't actually free all of us if you're only focusing on one of these things.
That's right.
That's really important to how we approach all the different issues that our partners may turn out for, and that we also encourage folks to turn out for and try to link to the work that we do, even though kind of, we know that our lane is we're keeping that space for abortion continues to be a critical need for everybody in Georgia. Whether or not you think you're ever going to have an abortion, first of all, you never know what may happen in a planned or unplanned pregnancy. Secondly, it is a guarantee that somebody that you know and love has had an abortion, whether or not you have ever heard from them about it. Thirdly, as we talk about reproductive justice, again, broadening the frame to, we're talking about people of different gender identities. Some people are cis women and they need abortions. Some people are not cis women. Perhaps they're gender non-binary, gender non-conforming, or they're trans men and they still have a uterus and they may become pregnant intentionally or unintentionally. And you never know when you may need an abortion. And then the other side of the coin to that is that because reproductive justice also talks about our liberation as people, no matter whether we are, no matter our gender and no matter our sexual orientation, there are many different things that may come in our reproductive and family making experiences. In some cases, that is the freedom and the choice and resources to have a family, yes, to get pregnant. And in some cases, it's to choose the healthcare that is right for us and affirms our gender. So there's many different pieces that may initially feel like they're, I'm putting this in air quotes, different issues, but it's the reproductive justice framework that shows why we have to be in solidarity for one another and one another's needs.
Very good. Thank you so much for that. Very, very comprehensive. And Dr. Suba, tell us a little bit about your perspective on what reproductive justice is and how it impacts the experiences of cisgender and transgender folks.
Yeah, absolutely. I think that each panelist has already covered an incredibly important aspect of reproductive justice. And I think I also think about reproductive justice in my work from the four tenets of reproductive justice, which is, that overarching, it is a human right And it's the right for people to have children if they desire, to not have children if they desire, and the right to nurture and parent and live full and fulfilling lives in the way that they see fit. So overall, it's a both a liberatory framework, a liberating way of looking at the world, but also a way of controlling your own life's trajectory.
Yes.
Freedom. So it's about, at its heart, it's about freedom. And what I think of when I think about reproductive justice is we often focus on the reproduction part, but I think we have to focus on the justice part, and that is about all the social determinants of health that as a public health researcher, we think about. So that is one, the right to live free from violence, the right to have safe and clean spaces and environments, the right to feel, no pain while you're going through this world, right? And so that's kind of the lens that I focus on when I think about reproductive justice.
Thank you. Thank you so much. And this leads me to the second question, which I will direct at Naomi first. Black women have the highest rate of maternal mortality in the US, and I'm sure all of us are aware of this. Naomi, tell us, how does implicit bias play a role in this statistic, and what can we do as activists and as voters to counteract the disparate impact?
I think tying back to what some folks mentioned earlier around the intersections of reproductive justice with other issues, for example, reproductive justice being a part of racial justice, is really important to have as a groundwork and framework and understanding how we even got to this place of implicit bias towards Black women suffering in this country in disproportionate amounts that really shouldn't happen in the United States in this day and time. I think for folks to support the grassroots organizing that many folks are doing on the ground, that abortion clinics are doing locally to support people in models that include the traditional healthcare system, but models outside of that look like doula care, that look like self-managed abortion care, that look like community circles that are created with peer support and midwives, is really important, because when I think about the Black women that we serve in our clinic, oftentimes, once they've arrived into our space, they've already had touch points with other healthcare services where people have missed the mark in providing really important resources that people need. And then when they are here with us, we're doing our best to not only provide what they're looking for in our clinic, but to undo some of the damage that's already been done. So when folks have the opportunity to pour in on a local level to work that's already being done to protect Black women, to support those collaboratives, and it doesn't have to just look like the traditional medical model. There are a lot of grassroots organizing that's being done where Black women are finding creative ways to protect and support each other, because we understand that really we've only got each other. That's really the way that it's always been. So looking to Black women who are leading this work and then trusting those who are doing so.
Absolutely. Very, very good point. I have been singing the praises recently of community health workers and talking about their position in clinical settings and how these entities need to deliberately and intentionally partner with CBOs and community health workers to bridge the gap, to help with some of the disparity in the areas of medical mistrust, which, it's founded in some ways, but it's the way that we're going to break a lot of that down. You're absolutely right that we are those gatekeepers. So thank you for that. Rula, I'm interested in your answer to this question, and I'll ask it again. Black women have the highest rate of maternal mortality in the US. How does implicit bias play a role, and what can we do as activists and voters to counteract the disparate impact?
That's a really good question. I don't have talking points about it, so I'm just going to try to be my thoughtful self on this.
Yes.
What we know, what we have seen, and what is probably true in all situations where we're talking about bias is there's the ways that it's baked into us at a personal or even internalized level. There's the way that it is baked into us at an interpersonal level, the relationships or interactions I have with other people on an individual level. Then there is the institutional, my organizations, hospitals, centers of employment. Then there is one level up, we're talking about structural. Sometimes that can overlap with institutional, but here we're talking about government, policies, laws, these things that we can't opt out of, right? I can't say I'm just going to go work under a different Georgia government. although we can try and work for that, right? We can try and work toward that. And then there's even one level up above that is the culture, the water that we swim in, and the ways that we are, what's the word? Inculcated, raised, brought up with these assumptions. And then that sort of feeds back into what's happening at the interpersonal and the personal level. So it is very complicated. I don't think there's one single method, strategy, or policy approach that is going to undo bias that harms Black women in maternal health, or that harms folks of color, like in any of these areas. But I think that what I want to talk about is ways that as voters, whether or not we hold these positions of power, right, we still have the power of a vote. And as constituents, we are people who can speak up and talk to our institutions and our representatives in government. And the positions of power that we may hold, relative power, right? If I am a clinician, a doctor, a nurse, an administrator in a social services agency, or even like a clerk at a bank, let alone a government official, any of those roles can be affected by the idea that Black people are able to suffer, and that's fine, right? We have normalized that idea that Black people can take on so much of this, pardon my language, but so much of this bullshit, so much of this suffering and oppression that has become like a historical norm in the United States, when like all of us are human. Mothers die and they have families, right? People have their lives turned upside down, and they're still a person with a body and futures and dreams. And the idea that because people of color and Black people specifically have like suffered or held so much for so long that it is okay, right? I think that's sort of like an implicit, well, it's not so urgent because it's been going on forever. And what we need to do is completely turn that upside down and say, it's been urgent. And what we need to do is keep our outrage and connect to it enough, to the feelings enough to say, what is in my power and who do I know around me that also has some measure of power, so that we can say, this has to stop and it should stop with me. And what can we do about it?
Absolutely. Thank you. Thank you very much for that. I want to go over to Representative Schofield, and I'm going to go over to my next question as well. Representative, public funding for family planning and contraceptive care are diminishing, and strict limits have been placed on abortion care in Georgia. What kind of impact do these impediments have on Black and brown people, particularly those who live in contraceptive deserts? What are your thoughts around that?
Well, I'm going to go back to something that Rula says. Certain things are baked in. And so when we talk about structural racism and we talk about structural oppression, we cannot separate a social determinant of health from a political determinant of health. And when we talk about what can be done in the contraceptive deserts, what I'm going to say is follow the money. They are one and the same. And so going back to the value that we place on ethnicity, race, women, Black women, that ties into the fact of where access. It's an intentionality of limiting the access to basic human rights. And this has been going on for a while. This is, again, as Rula has said, this is nothing new. It is the fact that the people that are in these bases have baked all of this in. You cannot talk about transportation unless you deal with a social determinant of health. Who does it affect? How does it impact? You can't talk about food as medicine and then have food deserts. You cannot talk about housing as health. So everything ties back into a systemic issue that feeds into a social determinant of health that is triggered and impacted by the value that you place on ethnicity.
Yeah.
So, your question about contraception, this is a shrinking pool because, again, it's about control, it's about leverage, it's about money, it's about racism, it is about keeping people in their place. Who defines the place?
That's right.
Who defines the value of human life?
That's right.
So in the political space, in this systemic oppression, what you have is a long-standing it's not a holistic approach. It is how much damage can we do to bring into alignment the fact that certain people don't deserve anything unless we're, oh wow, unless they're not. It is just it's determined, it's decided. So these are all decisions that are made. And so, you know, when you say what can people do with contraceptives, deserts, and other limiting access to abortion care, you have the strongest thing, which is the power of the voice. I have the power of the pen. And even the two are not separate. They're one.
When you start getting stronger in your voice. And eventually, it's a process, but trusting the process, and that's where we get caught up. We want to work in silos. We want to, the grassroots organizations like Sister Song and Amplify are doing amazing work, but we want to silo that. We need the data. We have the data to support the fact that maternal mortality is, and it's been going on for years. We've got to now take that data, bring it back to their face, hold them accountable, and some oversight, keep up the advocacy work to put those pressures on them.
Very good. Thank you so much, Representative. Dr. Suba, tell me, I'm going to repeat the question for you. Public funding for family planning and contraceptive care are diminishing, and strict limits have been placed on abortion care in Georgia. What kind of impact do these impediments have on Black and Brown people, particularly those living in contraceptive deserts?
Yeah, and you know, I'll answer this from my perspective as a researcher to action, someone who believes in knowledge justice and does research in order to give that information to people like Rula and Representative Schofield. You know, in order for them to be able to bring these to policymakers and say, look at who this is harming. You know, what we know about Georgia is that 44,000 women live in counties without a single center that provides a range of health care methods. You know, there are 600,000 women in Georgia that are living in what are considered contraceptive deserts, which are counties that do not have reasonable access to methods. And I think I want to repeat what Sister Song says, where there is no access, there is no choice. You know, so we are limiting not only the personal decision-making autonomy of people without giving them reasonable access, but we're also saying here are even more barriers for you to be able to even get the basic care that you need. And I want to step back a little bit, because when we talk about you know, we talk about, again, like all of this in the frame of reproduction, it starts even earlier than that. When we're talking about young people and they're not, in Georgia, we have what's considered comprehensive sexual like education, but actually it's not, right? It's very, very varied by county. And so if we're thinking about where do we start, you know, the starting point can be even earlier, which is giving young people the power to understand their bodies, their relationships, and in general, then also ability to protect themselves in any way they see fit, right? So there is an incredible study that was you know, done through the Trust Black Women Network, and I can put it in the chat, but it was a qualitative study asking Black women, what are the barriers that you face to care? And Oriaku, who was formerly of ARC Southeast and now in National Network of Abortion Funds, and also Monica Simpson of Sister Song were part of this study. And all of the women in this study talked about the structural barriers that are things like not having economic justice, not being paid a living wage, and then therefore not being able to access transportation to go to health centers. So a lot of these I think it goes again back to what our other panelists are saying. Like, we have to think about much earlier than when we even talk about the health system. What does it mean to not have access? And then the final thing I'll say is that public funding for contraception, we do not have public funding for abortion care in this country, right? And there are some states that have expanded to provide public funding for abortion care, but that is not Georgia. And we are diminishing in public funding for contraceptive care. And Medicaid is the largest payer of contraceptives in this country. And I think a lot of people don't realize that most people are on, from like an absolute numbers perspective, on some type of public funding that affords them contraceptive options. And then we can think about, in terms of racial ethnic disparities, Black people are overrepresented in Medicaid. And that's, again, because of an economic justice issue. You know, we're looking at decades and decades of segregation. And we're looking at inequality baked into the systems that we are living and working in, as Rula pointed out, the water in which we swim in, you know? And so when we think about the healthcare system, we also have to think about the communities that we're living in.
Thank you so much. I really appreciate the point that you raised around youth. And how this starts from us not even offering comprehensive sex education as part of the curriculum here in Georgia. You know, so the systemic parts of this, you know, reaches beyond boundaries, and we have to look at it from all angles. So I appreciate that, Dr. Suba. I'm going to pass it over to Chris now, who will continue to ask questions of the panel.
And actually, Tamika, I would like Naomi as a provider, as someone who works as a provider, to answer the question as well. And I can certainly repeat it for you, Naomi, if you need me to. Public funding for family planning and contraceptive care are diminishing. Strict limits have been placed on abortion in Georgia. What kind of impact do these impediments have on Black and Brown people? And I'd really like to know, from your standpoint as a provider of abortion care and other care, what's going to happen in clinics like yours?
Sure, thank you for your question. So speaking to this issue of contraceptive deserts, before this time period that we found ourselves in around the attack on reproductive rights, we already had folks coming from different parts of Georgia to our clinic who didn't have access to care. We've just seen that things have gotten more difficult, particularly for Black and Brown folks. Some creative initiatives that we've tried bringing in our clinic through our community outreach program with our community health workers is expanding our offerings in different counties. Originally, we've been working in DeKalb County, Cherokee County, now we've been working in Gainesville, and having these outposts in different counties where folks can come and connect with a member of the Feminist Center to receive services. Granted, we're just one organization doing our best to work with partners. The need is much greater than what we've been able to provide. We've worked on providing Plan B outposts. We've worked on providing information to community members, but we're seeing that folks who are already slipping through the cracks find themselves in even more difficult situations. And speaking to what other panelists have mentioned, when there is a lack of access, there's clearly a lack of choice. And it honestly has placed a larger burden on our community health workers who've been working with folks in rural areas throughout Georgia. And we've been doing our best to meet an ongoing need. We continually have people come from different parts of our state looking to us in our center to provide for them care and access. And they're desperately needing that within their local communities, because it already requires for someone to reach out. Say, I'm thinking of a patient that we worked with this past week. They'll contact their clinic. They'll connect with a partner organization for funding. We'll connect them to transportation support. Not everyone has access to that. Not everyone has funding. Not everyone can speak English. There are multiple levels in which we're seeing this need. And I would just say that it's something that's really important that we're relying on our partners throughout the state to support us with.
Thank you. Thank you very much. And for those who are in the audience and listening to us, if you have any questions at all for our speakers, please add them to the chat, and we can certainly answer those for you. And then Dr. Suba has placed a PDF in the chat referring to the Trust Black Women Network that she referred to in her presentation. And now to the next question. Bills to restrict abortion pills and refine the 6-week abortion ban will probably be considered during the next legislative session. What are avenues for offense and defense from a legislative standpoint and advocacy standpoint? And I'll start with Rula.
Thank you, Chris. It's a great question. Offers me the opportunity to talk one more time about Amplify and why we were formed. And our partners really recognize that a lot of the times that we are strong in collaboration, it's because an urgent need has brought us together to, often in Georgia, fight to stop a bad thing from getting passed, or from, happening and harming our communities, or to make a bad thing that's inevitably going to pass a little less bad as it passes. We knew that because we have shared visions and these relationships, we could do something different, without taking away from the need to respond to what is bad right now, in a, what's the word, in a harm mitigation kind of way, a harm reduction kind of way. We also can set a vision for what would it actually look like if we had full access, equitable options, the freedom to choose what was right for us, and not just make that decision in our minds, right, but have the resources and respect and rights to put it into practice. And so that's where the proactive work comes in. And then, of course, there is the reactive or the defensive, which is also important because we can't wait 10 or 15 or 20 years to try and mitigate the harm. And so I will let other folks speak to some of those efforts in terms of what can we do in the shorter term to start to, I guess I'll say, play defense, but also like reverse some of the harms of, for example, the abortion ban, the discrimination against transgender young people that has been happening, the fact that, here in Georgia, it is entirely legal for employers, I'll say legal, it's not legal, but there's no consequences for an employer to retaliate against someone who reports being discriminated against or harassed on the job. These are pieces that just changing that piece is not going to get us all liberated, but it's an important measure, right, in the meantime. So we can talk about what's coming up in the coming legislative session, attacks we think are going to happen, stuff we need to fix. In the long term, one of the things that I'd like to mention is that Amplify Georgia's flagship collaborative campaign with our partners is the Reproductive Freedom Act campaign. And that is, I don't know if this resonates with folks, I've taken to calling it the Green New Deal of our local movement, because we know it doesn't pass overnight. We know it takes a sea change in who is in power politically, but it also takes optimism on the part of communities and voters to think and know that we deserve much better than we have been given. And so for 20, 30, 40 years, law after law has been passed by the Georgia legislature that restricts abortion in these ways that sort of like cut at the corners and then like harm certain specific communities or groups of people in ways that they don't get defended or protected about to the point that you may go and try to have abortion. And I'm talking about before this ban that has banned almost all abortions, starting early in pregnancy. Prior to that, we've had, about 20 different restrictions on abortion that are not medically based, not medically justified. They don't make people safer. In fact, they just sort of put more hoops, barriers, and obstacles in the way. And that harms people, and inequitably so that the people who are already facing barriers to healthcare, folks in rural areas, Black and Brown and immigrant folks, young people especially, people who don't have a lot of income or are making low wages at their job, all of those folks, all of us are harmed even more, right, by these restrictions. But we have come to think that this is just how we have to do to get care. It must be part of the medical process. That's how baked in it is. So we have to go from that level of assumption to these are actually laws that were passed without a rational justification. They are not needed for improving quality of care or safety, and they make things harder and worse for folks' health outcomes. And we deserve better, and it's actually in our power, and it's in legislators' power to change all of this. So it is a big long-term project to make sure that every one of these medically unjustified restrictions on people's quality care access to abortion care is taken away and is replaced by something that is actually public health oriented, not criminal punishment oriented. So that's what I want to say on that. And I think that there are things that we can accomplish in the meantime, we may not get all 20 things repealed in one go. We may not institute equal access to care for people who don't have a lot of economic means next year, but we can start with the things that we know that there is consensus for. One of those things, of course, is that a majority of Georgians do not believe that we should have a 6-week ban on abortion.
Thank you, Rula. I'm going to ask the same question of Naomi. I understand you had the opportunity really to testify recently on the 6-week ban.
Sure. So when I think about the 6-week ban and how it's impacted our patients, I'll loop back to a little bit of what I was saying earlier around the barriers and hoops that folks already had to go through to access critical abortion care, and then what happened afterwards. We found that we were having to make calls to patients who had already made travel arrangements, who'd already received funding from national organizations, who'd already had secured their childcare, and unfortunately had to let them know that we weren't able to provide for them what they needed. And I've been thinking about really how we can be proactive on a local level. It's something that with our partnership at Amplify, Feminist has been working towards. There is something currently, for example, I'll share, I'm sure you all know about resolutions like in the city of Atlanta that were passed. We're working on something similarly in DeKalb County. A few other cities and counties in Georgia have gone ahead and passed these, where folks have recognized, okay, there are different avenues that we can be proactive, and folks want to be empowered on that level and make sure that people that we've elected into office are protecting us on larger levels and on smaller levels, and connecting our community members. For example, our clinic is in DeKalb County, connecting our community members to their county commissioners, letting them know who it is that they need to communicate with to push these resolutions forward, to connect them to opportunities for them to not just support us at pulling up to the Capitol one time, which is important in our defensive work, but being a part of our long-term strategies, as Rula mentioned, on the local level, I think has been empowering for our community as a whole.
Thank you. Thank you. And Dr. Suba mentioned postpartum Medicaid. Can you expound on that?
Yeah, so one great, I would say, success recently was postpartum Medicaid expansion that's been instituted in Georgia from what used to be for a very long time, 60 days postpartum, you would have Medicaid coverage for a new parent. And now it's been increased to 6 months. Still not good enough. 6 is still not at where we should be, but it is a proactive policy that is supporting the health of families, giving people who are pregnant that time and space to be able to connect with a healthcare provider. And then we also know that when we expand public funding, there is social good. And when we constrain or continue things like bans or coercive policies, there is a public health bad. There is no public health good from abortion bans or restrictive contraceptive policies. And the data bears that out unequivocally. So when we watch these hearings, and I want to thank Naomi and Rula for all their work fighting these abortion bans on the front, because I think we call it colloquially the 6-week abortion ban, but it is a full ban. It is actually a fetal cardiac activity ban. So once a provider determines there is some level of fetal cardiac activity, this is not equivalent to a full cardiovascular system. That person is not eligible for an abortion in Georgia and must go elsewhere. And we are looking at on the ground, I am not a provider, but I am in touch with a lot of providers who are doing their best to provide within the letter of the law, who are continuing to try to make sure that people can have care in emergent situations. But their hands are often constrained within the healthcare system. And this is only going to create a situation where there are more pregnant people who are waiting and putting their life in greater danger before they can actually get the care that they need. And that overall devalues, people who are pregnant as human beings, as people who deserve care at the moment that the care is necessary, right?
Mm-hmm.
So I would say the other policies that you want to think about are a lot of these other justice-based policies, you know, where there's public funding or public expansion to make sure that people who just are not making enough in this capitalist system are supported, then you will see public good. And that's really been borne out in a lot of the data.
Thank you, Doctor. And State Representative Schofield had to leave us. She had a state-based issue to deal with. So we certainly would love for her to talk to us maybe later on about the same standpoint as she begins to fight for us on the legislative level coming in January. And our last question, what can advocates do to assist you in your endeavors? So I'll start with Naomi.
Thank you, Chris. I would say that for folks who want to get involved with our center, one of the things that I appreciate the most about Feminist is that there are different levels of opportunities for engagement, depending on folks' capacity, folks' background, and folks' interests. We work with folks who are parents, who are students, folks who have been clinic escorts for decades. And right now, as we prepare for legislative session, we have specific needs for volunteers in this area. In the same vein, our community health worker program continues to expand. Volunteers who are interested in supporting this initiative and folks who are interested in supporting our Black Women's Wellness and Lifting Latinx Voices Initiative programs. We have a new general volunteer platform that we've been onboarding folks on. If any of those areas interest folks who are on this call, I'd be happy to drop that in the chat. And connect folks to our different programs and our different program managers, because the different issues are intersecting and they end up supporting each member of our community. But however someone can support goes a very long way and means a lot to our center.
Thank you. Dr. Suba.
I think that one of the ways that is to learn a little bit more about the RISE Center and some of the work that we're already doing. And I think our job actually is to support people who are the advocates here. So it's not that I need support from advocacy members. I already feel like I have a lot of support from them. I want to learn the ways that I can proactively support advocates. So I want to just publicly say, you know, on this, if there are advocacy organizations that want to reach out to RISE, if there's community-based research that we'd like to, that you think is important, you know, and you're part of a group, you know, reach out to RISE and see if we can help you get some of the capacity, power that you need to get some of the information that will help like solve problems in the communities that you're serving.
Can you put that information in the chat, Dr. Suba? Because definitely that is key. Information is certainly key to what we do as advocates. Thank you. And then Rula.
Was there another question, or it's the same?
Oh, yes, it's what can advocates do to assist you in your endeavors? I think you've talked a lot about it, but
Sure, thank you. Our collaborative is made up of organizations around the state. And so if you are part of a group or organization that you would like to bring into collaboration for especially these proactive measures, but also coalition building during the session for reproductive justice and injustice attacks that may come, please, I will also put my my information in the chat. Please reach out to the Amplify Collaborative. We'd love to talk with you about partnering. If you're not part of an organization and you want to know how you can be part of this, get in touch too, and we'll make sure that you are part of the conversations between our partner organizations and community members. And one more opportunity that's coming up quite Wednesday, October 9th, we'll have the monthly reproductive justice community call where folks who are newly interested, folks who are seasoned activists can also join with partners, our member organizations and organizers, learn about what's going on in our current proactive campaigns and what is the latest that has happened that we may need to respond to. So you can come to that space, get a little bit of community information, action opportunities, and start to find your place in all of this if you haven't got one yet. we would love to hear from you.
Thank you, Rula. Are there any questions in the audience? All right, seeing no questions. One thing I wanted to certainly tell you about is that SisterLove is hosting a canvassing opportunity this weekend on Saturday and Sunday in the Atlanta metro area to really discuss with voters the importance of reproductive justice and engage in discussions. And this is extremely important, particularly because the election is right around the corner, just a few days from now. And so if you're interested in certainly participating in our canvassing activity, you can certainly contact us at our website, which is sisterlove.org/events, and you'll find information about our canvassing opportunity. And Tamika, do you have anything to close us out?
I just want to thank our panelists again for joining us, and for all of the guests that joined us in the Zoom room, and for those that will join us by watching online. We just want to appreciate all of the support and encourage you to continue to follow us at SisterLove Inc. on all social media platforms, as well as keeping up with our current activities at www.sisterlove.org. It is really, really a pleasure to be in this space with you all, and really appreciate your commentary tonight.
Thank you. And I'd like to thank all of you as well, to our speakers and even to our audience for coming and participating tonight. We hope you have a good night, and we'll see you at the election booth on Tuesday.
You got it. And Rula put in the chat, I just want to lift up if anyone would like to bring an organization or partnership or find an RJ org to join, they can all contact her at rula@amplifygeorgia.org. And I'm here to tell you, by way of experience, she is really available to assist.
That she is.
Yeah, she is.
Thank you, everyone.
Thanks,
Thank
everyone.
you so much for having us.
Thank you.
Thank you all.
Good evening.
Good evening.
Good night.